Ladies and gentlemen, welcome back to the RedShirt podcast. Today we're diving into a conversation that's becoming more and more important in our communities: cannabis and mental health. There's still a lot of misunderstanding around cannabis. Some people only see it as recreational, others only hear about it in policy debates, but in reality, there's a growing movement in healthcare that's looking at cannabis as a tool of healing, especially when it comes to mental health, chronic illness, and improving overall quality of life. Joining us today is Dr. Cynthia Gourneau, an Anishinaabe, Métis, and Omaha doctor of pharmacy who has worked across tribal healthcare systems, helping improve patient care and access to treatment. She's also a partner with the Western Hemisphere Indigenous Network, helping guide our work towards a more health-centered, responsible cannabis industry, one that puts people before profit and focuses on real outcomes in our communities. Today, we're going to talk about cannabis as medicine, mental health, and what a better system could look like moving forward. So to start us off, you've worked in tribal healthcare systems across the country. From your perspective as a pharmacist, how is cannabis changing the way we approach mental health and patient care?
So I would think in today's society, it's very scary because cannabis is still highly stigmatized. It is something that we did not learn in school, medical school, pharmacy school. It is something that is hidden from science. And this is something that needs to be known, is that every biological creature has an endocannabinoid system. Mostly everybody, but insects have this ECS system in which cannabinoids such as THC and CBD can interact within these systems. So this here is medication put right next to us, right here for our use. If we didn't have the receptors for this, it would not be medicine. So this is Creator's way of saying, hey, for those that need help, a healing hand, I have placed this beautiful plant here to assist you with that journey. So as a pharmacist, I have a colonized, westernized education where I've learned all the chemicals that can be prescribed by a doctor. And to me, it's really kind of disgusting to think about because all I've memorized are the side effects to these medications and how they harm people. So the biggest thing I do is I ensure that the doctor prescribed the right dose so people aren't harmed and so they don't have massive side effects, which can be harmful in themselves, one of which is always death. Please know that death is a common side effect of every medication that you may take of colonized medicine. It is poison, in my opinion, whereas cannabis is a plant, is medicinal in every nature, and it brings back a homeostasis for those that really need it, those that have suffered intensely, especially natives have been through so much trauma, intergenerational, historical, along with contemporary trauma every day. Being native, living in a genocidal world like this, is common nature for us to see ICE out and about, shooting people, shooting Americans. Well, this is how we live every day. This is nothing to natives. I mean, our system has been overstimulated like this for centuries. With the oppression and colonization, we lost the way. They stole our ways to bring that homeostasis back. Culture, language, medicinal practices, healing, they outlawed our religious practices until 1978, when I was born. We were once able to practice the way that we pray to the Creator. I just can't believe that. I mean, how can you expect people to survive without that? But we're still here. And we're still here because we're strong, even with all the disease. Man, they should have took out all of us. But those that are still here have the strongest genetic code ever to overcome European disease. So yes, we truly are survivors and warriors here. We're still here. And I feel that cannabis is a decolonized way of healing. And I call myself patient zero. I am no longer on westernized medication. I only take cannabis, a capsule, and 1-to-1 THC and CBD. I take it 2 times a day. I've been on it for a year. And I have taken myself off of Wellbutrin and Lexapro. And you know what? I feel wonderful. For the first time in my life, I can honestly say I am not suicidal. On westernized medications such as Wellbutrin and Lexapro, which do increase neurotransmitters in your brain, but not in a holistic way. It's kind of like a piecemeal way. I was suicidal every day, and I turned to drinking every day because I did not have access to cannabis. As a practicing pharmacist, I did not have access to cannabis. So I became an alcoholic instead. My husband also is a practicing alcoholic. We would binge drink, and I've been sober for 5 years come August. With the help of cannabis, my best friend Mary Jane has assisted me with sobriety. And so to this day, I am super grateful for cannabis has saved my life in more ways than one. I could have committed suicide when I was younger, but instead, cannabis, I started smoking when I was 17. And at first, I felt normal, like, wow, this is what it feels like to be normal, to be human, to not be in a constant fight or flight response. Since I was 3, I have been in that state. I was molested by my uncle. When you're 3, your innocence is lost and you're in that fight or flight response. For 44 years, it does a number biologically on your system. Medical cannabis can bring that back to a homeostasis in no way that westernized medication can. So this is why I feel that the newer generations are open to the healing powers of cannabis. It is time to destigmatize cannabis. My generation, we still stigmatize it. It's now, I'm a true believer. And so this is what I bring to the table. I bring a new way, the decolonized way of healing, and that many of you are already doing. And I applaud you openly using cannabis and screaming at the top of your lungs how healing it is. And you've already dropped westernized medication. And I love that. And I'm ready to follow in your footsteps and learn from you. So let's do this together. I'm ready to take this journey together.
I have a very similar story where cannabis saved me from alcohol. So I think that is because Indigenous people, we have the highest rates of alcoholism, and which leads to the highest rates of diabetes, heart disease, all these different things. Cannabis really here just being used to stop alcoholism is going to be a positive domino effect into the future. But because there's so much, stigma against cannabis and marijuana from the lumber industry, from the tobacco industry for the last 100 years, people are still trying to get out of the mindset where it's like, this is a drug. Okay. And so I think if people saw more examples, even on their day-to-day, like back pain, like not being able to sleep, like having problems eating food, stuff like that, if they could just see and were educated on those things, I think our mindset would shift from recreational into medical. And then from there we can, kind of pinpoint where it's good, where it's bad, where you need it, where you don't need it. So I think, once we're out of that mindset I think it's really the profit building mindset. I think once we're out of that, then we'll have more room for that medical side. And even the recreational side might get a little bit better.
I think the biggest thing, though, is the fact that it needs to be destigmatized first, because how can you learn about something that's stigmatized? So this is something that we will bring to the table, is learning about cannabis, what it entails, how to use it in a medicinal, correct way, not just recreationally it's not just Cheech and Chong, lots of smoke. It's really a lot of healing can be done here, especially when taken orally like I do. I take capsules and it's just a really wonderful feeling. I feel like I'm in the best health of my life, the best mindset of my life.
And I think some people might not have been able to feel that yet because the only option they've been given is smoking. So it's like if you have to smoke the flower, some people might not like that, but then when they get the pill or like
the capsule is similar to taking an antidepressant where it's consistently there. And CBD does mimic an antidepressant because it increases dopamine, and it is similar to serotonin, increases your mood that way. So it works in ways that we're still trying to understand. And all types of different forms of cannabis can work for people, and people can dose in any way they see fit. but I really am an advocate for taking oral cannabis for chronic behavioral health and pain management for our people. I also believe CBD has the power to help with diabetes as well, because I'm diabetic and I've been off of my medications for over 90 days. I went and had a checkup. My A1C was 6.3, which is very good for a diabetic. So, and this is just taking the heather. I have lost weight and things like that, but it'd be interesting to see in our people what benefits there are, because it has been shown that CBD does mimic the drug Actose or pioglitazone. It helps to increase glucose uptake by the cell. So there's a little bit of research on that I think is very interesting.
So from what I hear and what I've read, you've helped patients transition away from things like opioids and other heavy medications.
Oh, definitely, yes. I've gotten people off of, I had one gal who was on Dilaudid post-surgery, couldn't even go to work. She did a factory job. Got her on a THC suspension. She was so grateful. She was crying. She was thankful. I can work now. Thank you so much. And so this is what cannabis brings to the table. It brings healing without those side effects that really can decrease your quality of life from westernized medication.
And a lot of those side effects do impact your day-to-day life, like going to work. And from what I know from, and for the audience, like when you speak about your experience with cannabis, it's not going to be the same as anyone else's, I'm assuming, unless there's a lot more studying done. But, from my experience, cannabis has helped me sleep. It's helped me wake up. It's helped me, with my back pain. It's helped me with, I play basketball a lot. It helps me with joint pain. And I haven't even used the specific, like the lotions for joint pain. When I start to use that, that's going to be way better than me, just taking it orally. But that's where this conversation does need to happen, because right now the medicinal isn't really being put on a pedestal the way it should be, like the lotions, the capsules. Like we said, right now that cannabis industry is mostly built around business and profit. What would health center community-focused cannabis systems look like for tribal nations?
I have worked for multiple tribes, and I've learned about a program that's called the 340B Special Drug Pricing Program. And with this program, I've been able to optimize third-party revenue for tribes, actually prescribing much needed medications. For example, I used to work at the Urban Indian Clinic in Chicago, the American Indian Health Services of Chicago. And once I was hired there as the pharmacist diabetes educator, I optimized the program. I increased the locations for Walgreens from 3 to 63 throughout the entire state and throughout the urban area, so natives could get access to their local Walgreens to get their medication also at no cost. So this is something that we could definitely bring to all tribal clinics and also all FQHCs, federally qualified health centers here within the state, which serve indigent people. And so what we could do is we can optimize the billing, and then with this billing, this revenue, that I went from being in the hole from $1,000 a month to making $15,000 a month off of just 9 patients. And with this profit, I was able to purchase the SOAR CBD line from Leafline, which is CBD without THC at all, Zippo THC. And so I got a topical, I got some capsules, and I had some other items that we tried. But all in all, they just weren't sufficient because they lacked the necessary component of THC. It comes as a group package. They need to be together. It's something called the entourage effect. Like all of those components from cannabis, they need to work together. You can't just pick and choose. But utilizing this, I had patients that did get lots of relief from the topical to where they didn't have to take a muscle relaxant. I mean, instantaneous release, like on, the upper shoulders, the back. I had people that tried the capsules. They did help for a little bit with pain relief, but then it went away and the pain returned. It did help a little bit with mood, but then it went away. Like it wasn't sufficient again because it wasn't full spectrum. Oh, and I also had the chance to try some drops, CBN cannabinol drops. And so we were able to have patients try this and they loved it. They were able to sleep. It was just wonderful. And this is something that can be done at all tribal clinics, at FQHCs. We can increase revenue. And in a state where cannabis is medically legal, we can then purchase cannabis at no cost for our patients. We can integrate healthy, safe alternatives for cannabis, such as capsules, suspensions, lozenges, tinctures. We don't require inhalation. I'm not an advocate for inhalation. It is an option, though, when people are suffering. It is the fastest acting option. But there is definitely a way for cannabis to be a cornerstone in all tribal clinics, along with our own medicine. Let's bring that back too. This is all about decolonizing medicine. So we're going to bring back our own ways as well. And that's something that also we lost. They forced us to, we lost it, but there's so much healing there that needs to be known. So it's time to bring it back. Let's do it.
I think that now that cannabis is in the medical spotlight, as well as psychedelics, from what I've seen, but, we're going to be able to open this conversation. Obviously, right, sometimes the wrong people are bringing these good things to light. So they're not really targeting those real community issues right away. But because, again, we live in a country where things do have to be profitable to exist. But at the same time, those places don't exist if the community doesn't exist and isn't healthy. So it's like, honestly, you would think these organizations would center the health, because then their workers would be healthy. Then they wouldn't have to worry about this turnover rates that are happening everywhere. I don't think there's a place that doesn't have employees coming in and out because of mental health issues. I know my mental health kind of showed through my job placement back in the day. When I was drinking, when I wasn't grounded, I would have a different job every year. And even if I was good...
Oh, that sounds like me as well. I concur, yes. I was not a good people person. I've lost many jobs.
And for me, it was almost like it got to a certain point. But as soon as I started to, first of all, stop drinking, but that's easier said than done for a lot of people, right? Oh, yeah. So then you need something to help you, which was, in my case, cannabis. And I wish that my brother, who had passed away from alcoholism, would have started cannabis earlier. I heard that he had started just a little bit too late, because he was pretty against it for a long time, because it's illegal, right? It's like, it's not really in your mind if it's illegal. But then the second that it was legal, he was able to test it. And I know this because there was we found a WHIN box in his truck. So it's like he tried it, and unfortunately a little too late. But that's why I think we do this push for those people, because there is alternatives to, the medication. There's alternatives to even some of these treatment options that people get. If it was paired with cannabis health, I think a lot of lives in general would be changed, because Indigenous people, we're not the only ones who have addiction problems. We have the highest rates of addiction. But I think if we can fix this problem and make this health centered in the tribal community, that we can take it beyond and really make all of our communities healthy. So for people who are curious but unsure, what should they understand about responsible cannabis use for mental health and overall wellness?
Cannabis can be used responsibly. Cannabis does not kill instantaneously like all of these street drugs. Fetty is, I learned about fentanyl in pharmacy school back in the day. And it was the one drug that scared the shit out of me, because they created it to not only sit on the opioid mu receptor, but to bend in and hyperstimulate it, which is super disturbing to me, which is, good for pain control, but it also causes respiratory depression, instantaneous death. So the fact that my children can go out and get a sack of weed that's laced with this fentanyl these days, today, is I can't fathom it. I'm disgusted by this. So this is where safe medical cannabis comes in. Let's bring it and do it the safe way, because from seed to sale, I know where this cannabis comes from. Cannabis also does not cause respiratory depression. There is not one case where it has killed anyone. Cannabis saves lives. Alcohol kills people. Westernized medication kills people.
And I think that this these are the conversations that are going to make that known. And you being who you are, your story, you're bringing all this to light, because unfortunately, there's a lot of people who would like to, but are maybe scared to.
Oh, yeah.
And so that's the warrior in you. That's who's standing up and actually, at some point, I think a lot of people who are listening to this podcast, they're a lot of leaders. And I think they understand that a lot of us we're lone wolves who are standing up in our industries, and we're starting to see each other over the horizon, and we're starting to connect, and we're starting to create our own health-based industries where other people, they don't really care about that industry. So it's left us a clear path. I think that's what we're doing here. And I think that's what you're doing by, sticking to your experience and also listening to other people's experience. You do that every single day. I really appreciate you coming on and sharing your knowledge and your experience with us. You've worked in tribal healthcare systems and have seen firsthand how mental health, medicine, and cannabis are all part of a bigger conversation about healing in our communities. For everyone listening today, what advice would you give them as they think about their health, their mental well-being, and the role cannabis might play in that journey?
I look at your generation, the younger generations have really respectable, responsible use of cannabis without the overuse of alcohol. I have coworkers that will occasionally have a drink, and I think it's amazing because at that age, when I was 22, up to 27, I was a binge drinker. But to see this, I feel that we can learn from your generation, and I think integrating cannabis is what's right. It's what's right for our people. It's what's right for all people. It is the way to heal in a safe manner and to decrease and get opiates and things that kill off the streets. So I have also gotten people off of Suboxone using the Heather, the 1-to-1, gotten people off of methadone. So it is definitely possible to utilize these to help with substance abuse. I know it is. So there's definitely hope.
Well, Cynthia, thank you again for joining us today and sharing your knowledge and experience with us. Conversations like this are important because they help move us away from the stigma, misinformation, and towards education, healing, and healthcare systems for our communities. Cannabis, when approached responsibly and with the right guidance, has the potential of being part of a broader conversation around mental health, patient care, and community well-being.